Hello, Dr. Berg here. In this video, we're going to share with you some data on protein. There's 9 points I want to bring up, starting with digestibility. A lot of times people, when they get older, they can't digest red meat like they used to. Okay, why is that? Because the collagen in the red meat is actually more plentiful than in white meat. And so when they start to consume it, it becomes more difficult to digest. They get indigestion, and it doesn't seem to process that well. Okay, so that's a factor. So maybe you can't consume that much. If that's the case, you can either do a different type of protein, or you can add more betaine hydrochloride or apple cider vinegar to make your stomach acids more acidic, because it's really the acid pH that helps activate the enzymes for protein in the stomach that allow you to digest the collagen that you need for your joints and ligaments and tendons. So rather than not consume red meat and be lacking that collagen absorption, why not just get your stomach really strong? As you age in the 40s, 50s, and 60s, you start losing your stomach acids. And that's the problem that most people have, especially if you're taking antacids or you're taking any type of medication that gets rid of stomach acid. Okay. So, and then also lean versus fatty protein. Believe it or not, it's easier to digest fattier protein than lean protein. Like if you did whey protein powder versus the fatty hamburger, not with the bun, but just regular hamburger, the fatty hamburger is much easier to digest, believe it or not. So apparently in Mother Nature's design, protein always come with fat. You never see just lean protein in nature. So just consume it as its whole form, not some lean anything or low fat anything. Sometimes people have an allergy to seafood. So that would be an allergy, so you're not going to digest it. You're going to react to it. You're going to reject it. Or like hemp protein powder, when I consume that, my body just cannot digest that. So that wouldn't be the source of protein that I can digest. It bloats me. Or let's say you're allergic to casein or milk protein. You're going to, of course, you can't digest it. Or peanuts, so you can't digest the protein in peanuts. So that would be a digestive factor to look at. Okay. Number 2, stress and the adrenals. The more stress you experience, the more the adrenals are active, the more cortisol is going to be released. And when you have more cortisol, you get more of a catabolic effect. That's more of a breakdown effect. So here you have the situation where you're breaking down protein faster than it's building back up. So if you have an accelerated breakdown process of protein and it's not coming back up, you're going to need to consume a little more protein. So that's why adrenal cases or adrenal weakness or adrenal body type cases need more amino acids or protein than people that don't have that problem, simply because they are breaking down more protein than they're building back up. One point to consider. Okay, number 3, the quality of protein. Make sure it's grass-fed if at all possible. Make sure it's organic without hormones. Wild-caught if it's fish, not farm-raised. Pasture-raised eggs. These are all real key points of quality. Number 4, insulin. So if you're insulin resistant or you're diabetic, you're not going to have that little key that opens the door that allows the amino acids to go in there. So you're going to be deficient in proteins. That's why a lot of times it's hard to get toned, or you might have loose collagen or hanging tissue from your body. So you're going to need a little bit more amino acid. But the main thing you're going to need to do is fix the problem with insulin. I have tons of videos on that because even consuming more protein is not going to fix it. Okay, it's just one factor to consider. Next one is number 5. Is the protein complete? If you're a vegan, you're going to have to combine different foods to get your complete protein profile. But eggs have a complete protein profile. Animal products do as well. But eggs are really good for a complete protein. All right, next one is number 6, the amount of protein. Make sure it's not excessive. Don't do this massive amount of protein that is like 10, 12, 14 ounce steak type thing. Do between 3 to 6 ounces. That's all your body needs. Anything more is going to strain the liver. It's important. Now let's talk about growth hormone. Growth hormone interacts with protein in that it helps spare proteins. In other words, it prevents muscle loss. So when you stimulate growth hormone, it helps to preserve your own muscle protein and your own collagen, all the protein on your body. So that would be intermittent fasting, So by not eating for a period of time, you'll actually spike growth hormone by 2,000% and preserve your muscle protein, so you'll prevent muscle loss. And other proteins as well. So this is important. Intense exercise will help you. Good sleep will help you as well. Those are the main things with that. Now, cooked versus raw. The more cooked a protein product is, the worse it is. So if you're having a steak, have it more rare than overly cooked. Very important with this to actually get more amino acid absorption. Okay, stomach pH, very common problem. If you are getting older or you had a history of indigestion or even heartburn or acid reflux, that means you don't have enough acid. And that's why I recommend apple cider vinegar with each meal, or you can get them in tablets, and that'll start building up your pH to allow you to digest and assimilate more of this protein. So those are the 9 factors of protein. Make mental note of it. Thanks for watching. Hey, you probably already subscribed, but if you haven't, press this little button down below and I will keep you updated.